on the restream or live via social media. So here we are. So we are letting you in. I'm doing this in two places in once, so super fun. You probably should be able to see my slides. So I'm going to give it 5 more minutes. And you could, even if you're on social media via Instagram or Facebook or LinkedIn or any of these YouTube, you can always add to the chat just from Facebook. So I'm going to give it just like 2 more minutes and we'll start firmly at 8:10 and I'll go quite fast. It will be a delightful talk. So I'm just going to go camera off, sound off for a minute, but put things in the chat as you will. And this will be great. Hi. Is there audio now? Sorry, there's doing this on two different streamings. How is it now? We're also going to record and send this out as well. The other side, they can hear me. Perfect. So I will go on, and whatever you missed, we will send this recording out. So never fear. Sorry about the lack of audio. So sexual health and wellness. So I said I was going to talk about male sexual health, and I absolutely will. So CB1 receptors are present. Of course, they are on the surface of sperm cells. They're in the placenta. They're also in sperm cells. Multiple studies have shown negative effect on sperm count, motility, and morphology. However, so most of these studies were pretty early. We are starting to get more and more studies. They were isolated for these factors. So if you're trying to conceive both male and female, probably better to take a break. And a few animal studies in the before time showed a decreased libido, but this has never been demonstrated in humans, just animal studies. And 50% of animal studies never cross into human development because we are very different from mice, similar but different. And cannabis and hormonal effects in men. So CB1 and CB2 receptors are in the testes, which is the main producer of testosterone. Earlier studies said that testosterone was decreased by cannabis use, but those studies from the 70s and 80s, they weren't the best. We still use this actually, the government sanctioned Mississippi 13% THC, which yikes. Now we are getting more robust studies. We are getting them globally. Those earlier studies were small, self-reported. Did tobacco and alcohol make a difference? Physical activity. The two more recent larger studies actually showed higher testosterone levels in frequent and recent users. I'm just going to take a quick pause to check that everything is going well on your end. Yay! Sorry about that. Perfect. So this is, I just said, mice mean nothing, but then I'm going to show you a mouse study. This study was actually, this is about proper dosing and why it's so important. So the impact of CB1 agonist, which THC, and sexual interaction. So when we gave the female and male rats weren't available, well, we gave the female rats cannabis. When we microdosed them with THC, they had more frequent sex, and they were observed to have longer and more frequent orgasms, right? When we gave them too high of a THC dose, they freaked out. They did not want to have sex at all, and they were done. What we know about cannabis is it is a biphasic effect. So if you, I'm going to show a graph, it's probably easier, but you've probably experienced this. If you have the right dose, you feel great. You have just a little bit too much THC, you feel anxious, you don't feel good. Some people even throw up. It is not a pleasant experience. What's great is you won't die. It does end, but it can be uncomfortable. So humans, we show exactly the same thing. If we microdose, if we use the right dose, things are more pleasurable. If we don't, we want to avoid sex. We don't want to have it. We want to just curl up in a ball and maybe not eat. So there is a biphasic curve. So when we use low dose microdosing cannabis, oftentimes you don't have a full peak therapeutic effect, but you do feel something. We actually want people to be at the top of that curve. And as you see at the other side of this bell curve, higher doses produce diminishing returns. At Acute on Chronic, we actually created a dosing AI and assessment tool that can actually pinpoint exactly where patients should be dosed, both inpatient as well as while working with our services one-to-one. So we have figured this out manually and also patented an AI machine learning dosing tool to do the same thing, which is quite amazing. So magnitude of the positive impact of cannabis use before sexual activity. So let's talk about women. When women use cannabis, they have 2 times higher odds of having an orgasm and 2 times higher odds of having a satisfactory orgasm. So, that's pretty neat. Also, what's really fascinating is women report an increase in sex drive, improvement in orgasm, decrease in pain, and actually no change to lubrication, which is probably one of the most interesting facts about cannabis because, yet again, it's just if we discovered it today, it would be amazing. The reason that that's shocking is if you've used THC or you're thinking about it, is one of the side effects is it dehydrates you. So you might have dry mouth, dry throat, you might feel really parched. Sometimes this actually makes you dizzy if you don't drink enough water, but it actually doesn't affect any change in vaginal lubrication, which is fascinating. Um, and then if we look at men and women, we see that sexual frequency actually increases with cannabis use. This is self-reported. This was not a randomized trial, so there could be other issues. But women and men, when they use cannabis every so often or daily, they increase sexual frequency. And it doesn't have to be of the day of the encounter. It just is more frequent use equals to more frequent sex. So that's excellent if you are trying to improve that part of your life. So why does cannabis have such positive effects, particularly on women? We don't know. Women are complicated. The reason why we sometimes struggle with sexual health is complicated. I forgot to mention at the beginning, I do have a certificate from Rutgers in global women's health leadership. And in that, we learned about why women present with different problems differently than men. One of the reasons that we might struggle here is there's a lot of unpaid domestic labor. There's more child rearing just in general. Sorry, guys, global fact. And that the running to-do list in our head leads to a lot of anxiety. So that may lower frequency, increase inhibitions. We live in a world where Instagram models are everywhere. So that really affects how women feel about themselves. So what cannabis does is it does have the ability to affect your amygdala, where your emotions are, as well as your frontal lobe. So you oftentimes feel more confident. You're also decreasing anxiety, so you're able to take away that mental to-do list, at least for a little while. Other benefits is it slows the temporal perception of time. So if you only have 15 minutes, it could feel like you've just engaged in something for well over an hour. The other great thing about cannabis, when you hit that threshold of euphoria with THC, which is the only euphoric cannabinoid, things feel better. Touch feels better, sensations feel better, sound better, things look better, food tastes better. So heightened sensation helps. And then as well as the no changes in vaginal secretions is also another benefit. Alcohol has more of an effect to make you dizzy and does have very different changes. So there are some unique routes of administration. Rectal, we don't really know if this works. It may work locally for things like endometriosis, menstrual cramps, other belly pains or GI pains. We likely think that there's no THC bioavailability when you use a rectal suppository, but it may be dangerous if you're immunocompromised based on past medical history. So you want to be careful. This route is not necessarily for everybody, but we don't actually know if it's systemically absorbed. With vaginal, same issue. We do get reports that it does work quite significantly locally. It's a large surface area with a lot of blood supply. So it certainly could be a route to systemic delivery. We just don't know. And it likely helps with painful sex as well as endometriosis. And there are findings of case reports of increased orgasm and lubrication. And we can send you out, and you join our email list after this, we can always send you how to make that from flower yourself at home. I've done it before. It will make your whole house smell like a skunk. So be mindful. Hormonal health and wellness. So I want to make a note. I did say that there's really no research on women and not really anybody else either. So cannabis in the trans and non-binary community is really important. So there's little research here as well as little research anywhere else, but we do know that trans and non-binary folks do have higher rates of mental illness, and that they do oftentimes self-reported, of course, treat symptoms of depression, anxiety, PTSD, dysphoria with cannabis. We do know that trans and non-binary people do have increased health disparities and poorer care across the board, especially anxiety with seeking traditional care. I will say also there are studies about the LGBTQ community where people who identify as bisexual actually report the most cannabis use, more than anybody else. And everybody across the LGBTQ community does report anxiety with seeking care. And higher cannabis use is reported by trans folks for gender affirming surgery, post op, pre op, and who are taking hormones, as it could help with some of the side effects of hormones. With menstruation, it is pain relieving. People often use edibles. Even I've heard creams help because there are the endocannabinoid receptors that are topical on the skin. Terpenes like linalool, eucalyptol, beta-caryophyllene, both, all three of those work really, really well for menstrual cramps. And of course, this is a place where those vaginal suppositories could really, really help. What does this do? Why? It reduces FAAH inhibitors, which have anti-anxiety effects as well, and FAAH decreases estrogen. So if increased estrogen is leading to more cramping, heavier periods, we are all very delicate systems where if anything goes off kilter, our endocannabinoid system is there to lead us back. But, little hormonal changes anywhere can really lead to things that aren't so comfortable. When we decrease estrogen, we'll decrease side effects. Now, I want to make a note that with CBD and women who are perimenopausal and experiencing menopause or even postmenopausal, your timing of your cannabis dosing does make a difference. So if we're reducing FAAH inhibitors, thereby decreasing estrogen, you want to be careful when you're using cannabis. It would just might not help your sleep is really what I'm getting at here. So CBD at night, for example, we've noticed internally with peri or postmenopausal women, sometimes we keep them awake. Not always, but if we notice that, we do move dosing to the morning, particularly with CBD and CBG. And of course, you may not want to use cannabis if you're trying to conceive because it can disrupt menstrual cycles with a shortened ovulation, disrupt hormone regulation with decreased estrogen and progesterone. You need both of these hormones to be in perfect balance to get pregnant. I also wanted to mention, I do think I have a slide on this, that your menstrual cycle, not only your life cycle and where you're at as a woman, but your 28-day cycle affects how you metabolize THC. When you are ovulating, you metabolize more THC, so you will get euphoria faster. And when you're at the end of your cycle, you actually probably need to use more THC because you will not absorb as much, which is pretty fascinating. So other things you can work in conjunction with cannabis is estrogen replacement therapy. There are a lot of studies with that go back and forth. Definitely talk to your endocrinologist as well as your OB-GYN about and your primary care doctor before making that decision. There has been robust back and forth studies since the 90s about this. Pelvic floor PT, relaxation techniques, and lubrication all are very helpful, especially that pelvic floor PT. I cannot say this enough. I did have a slide on this. So like I said, the life cycle matters. As we move through the life cycle, children and teens actually have less endocannabinoid receptors, as well as the elderly. Once we turn 65, we actually start losing receptors. So in both cases, in children and the elderly, you actually potentially need more THC, which you wouldn't think. Most of the times when we dose those over 65, we're actually decreasing these things. A woman's monthly cycle matters, exactly what I said. So it matters if you have a regular cycle. This could be really hard to figure out, but our nurses are here to help you do that too. And menopause. So my favorite joke in all of cannabis nursing is back with DARE, they told us that cannabis didn't make you cool. And I, a nurse scientist, am here to say, yes, it does, because it controls thermal regulation and it actually decreases our internal thermostat and gives you a little bit of hypothermia, which cools you off. Haha. So cannabis does make you cool. I don't know if that joke is getting funnier every time I say it or less funny, but we know that it does lower body temperatures. So this effect involves that same serotonin 5-HT1A receptor. So it also acts as an anti-anxiety mechanism. It's antiemetic as well. So cannabis is your friend if you're going through menopause. It can help. Of course, dosing matters. So other considerations, I'm just going to take a quick look at the stream. Great. Everybody's good there. And everybody's good here. Perfect. Hooray. Success. So pregnancy and breastfeeding. Okay. So we are never going to have good studies on this. I'm sorry. We don't even have good studies on anything beyond Tylenol mostly. 30% of OB science I had read at one time is based in fact, and the other 70% is hypothesis and being fearful, which I understand. We don't want to do anything that we're not sure of. So there may never be double-blind trials on this. There will probably always be biased research. It is hard to obtain data and limited studies overall. Now, studies have been done, not in America. And there was documented use early medical times, 1800s, and of course, all the way back to 500 BCE China. But we're never probably going to get the studies that we need. So safety considerations. I'm going to try and go through these super fast. There's a lot. Don't mix alcohol and cannabis. If you are going out on a date, if you are having an encounter, if you're just going someplace fun, you don't know what's going to happen, or if you're just enjoying yourself wherever you may be alone, don't mix alcohol and cannabis. Pick a lane. They're both dehydrating. Even if you use cannabis as a medical user or recreational user often, or you drink alcohol often, mixing them together will hyperdrive dehydration, oftentimes will lead to vomiting. So definitely pick one or the other. Definitely do not go above anything you normally do in your cannabis dosing. And for alcohol, I would stay under 1, maybe 2 drinks, probably 1. See how THC and CBD affects you before having an encounter, and talk about limits and boundaries, of course. Practice the same safety you always do. Take the first dose at home, definitely of THC, without obligations before driving. For sure, we want to see how it reacts. And remember, every time you change to a new edible, a new route of administration, if you switch from liquids to a gummy to chocolate, they can all affect you differently. They're all grown in a very different way. Distillate is different. You know, there's a difference between rosin and RSO gummies versus all sorts of different things. So always give yourself 12 hours when trying a new product. You're going to be more aware of your body. How to find the right products. Check COAs of cannabis products. 80% of the CBD market, according to the Journal of American Medicine, is fraudulent. I'm sorry. And then the other remaining 17% to 20%, a lot of that, with few exceptions, typically has heavy metals in it. Beyond that, sometimes it's very old. There's very little CBD. There's arsenic, aspergillus. So always look at the COAs. There are some very fantastic, reputable companies out there, and we could always help you choose who those are, where they are, where to find those products. And then, of course, if you are choosing to vape, please avoid anything purchased inside a gas station, anything that you can't check a COA. There is e-volley. It doesn't actually happen inside the regulated market that we know of, although I have heard of stories happening. There are certain reasons why this happens. This mostly comes out of the tobacco world and things that you can buy at gas stations. It's because of vitamin D acetate, but also other factors can increase inflammation in people. Some of that is aspergillus, and that's a fungus found on any plants in a less humid place. Other medical considerations, if you're using cannabis, adult use or medical, just know, check your labs and liver enzymes about every 6 to 12 months. Now, remember, cannabis is really safe, has a great safety profile. This is just our team and me being just really hyper vigilant. And then cannabis can increase and decrease the absorption of some medications, anti-seizure meds, some of them benzodiazepines, antihypertensives. So definitely consult with a cannabis nurse. There are many of us out there. If you are on any medications, most of these are not contraindicated. You just need to be aware of timing with these things. And then what happens if you take too much? So one way to avoid feeling not so well and taking too much is stay hydrated. Drink as much water as you can. Take a hot shower or bath. If you do feel like you took too much, look in the mirror, remind yourself where you are, say your name, do those things that decrease anxiety. You could like pinch your hand to feel your body. That oftentimes helps. And then my real favorite secret trick is if you mix peppercorns, lemon rind, and even CBD, you can actually decrease feeling that uncomfortable, altered feeling. And then time passing always helps. Another hack I have is if you go to Trader Joe's, they have this lemon pepper spice. Literally take that, mix it with hot sauce, and mix it with CBD. Take a big spoonful of it, and within 15 minutes, you'll start feeling better. So that was this talk. So we have recorded it. We will send it out. Join our mailing list. We are happy to help you with menopause symptoms. We have a 9 out of 10 success rate reducing symptoms for our patients. So we can promise 90% of you that you will feel mild all the way to occasionally complete resolution of symptoms. We're happy to be your guide, talk to you about dosing for these things. And we do these talks often. So even if you don't use our services, know that we are on social media. We would love your follow. And we do talks in the community and in healthcare within the industry too. So we're happy to be around. And then something new that is coming in 2024 that we're so excited about, starting about March, is we are able to take pay what you can patients, as well as provide free care for those who qualify. We're still kind of working out who would qualify for free care. How do we make that decision? But definitely pay what you can. Pay what you can is going to happen both with medical cards and education. So if you are interested in this, please don't hesitate to reach out. We do want to take care of everybody, and Schedule 3 is coming. So that means that cannabis will be seen truly as a medicinal substance, which is great. So we're going to keep doing what we're doing, but hopefully this can be more integrated with healthcare, with your physician. And I'll take questions. I have a little bit more time, and thank you for dealing with the background noise. The joys of being a cannabis nurse is you get to travel everywhere and do cool talks from the beautiful United Lounge at O'Hare Airport. So if there's any questions, I can see everything on social media in the chat, and I'm super happy to answer them. I will give this a couple of minutes. And then I'm gonna stop sharing my screen actually. And then tomorrow and Saturday, I am going to be in New Jersey. And I'm going to give you the address. In Belmar, New Jersey, we're doing Ask a Nurse tomorrow from 3 to 7, and then Saturday afternoon as well. And that's at 136 Harding Avenue, Belmar, New Jersey. And so if you have questions, you want them answered live, feel free to stop by, tell your friends. If you have folks out there, definitely send them. So we're going to be there tomorrow as well as Saturday. And that was our talk. Sorry about some of the technical difficulties, but we've got it. And we'll send this talk out, and we'll do this again soon. And then follow us on our socials. We're going to repost snippets of it and the whole talk. So this was great. And thank you, everyone. Have a great day.